Today we will be reading Tiny Stitches, The Life of Medical Pioneer Vivien Thomas. Written by Gwendolyn Hooks. Illustrated by Colin Bootman. Needles didn't scare Vivien Thomas. In fact, he designed the ones lying on the operating table in front of him. The instruments were small and delicate like a toy, but these needles weren't toys. In a few hours, they would help save the life of a little girl. Vivien checked the instruments carefully. They were sterilized, razor sharp, and ready for a brand new type of operation that Vivien had invented. If it worked, the little girl would live to crawl, play, and grow strong like the other children. But would the operation work? Vivien Theodore Thomas grew up in Nashville, Tennessee. Vivien's father was a master carpenter who taught his son how to measure, cut, and seamlessly fit together pieces of wood. By the age of 13, Vivien was working alongside his father and earning enough money to buy his own clothes and shoes. He put the rest of his money in a bank to save for college. From a young age, Vivien dreamed of studying medicine. With 3 colleges and a medical school for African Americans, Nashville was the perfect city in which Vivien's dream could come true. In October 1929, the stock market crashed, and the Great Depression that followed caused panic, hardship, and heartache throughout the United States. Banks lost their customers' savings and were forced to close. Vivien was one of the unlucky people who lost all his money. He had to start saving for college all over again. Jobs were scarce for carpenters such as Vivien and his father. People could no longer afford to buy new houses or repair old ones. Luckily, one of Vivien's friends worked at Vanderbilt University and knew about a job opening at the medical school. Vanderbilt was an all-white university. Vivien knew that the school would never admit him as a student, but he hoped working there meant he was getting closer to his dream of studying medicine. The next day, Vivien met with Dr. Alfred Blaylock about the job. After a brief interview, Dr. Blaylock took Vivien on a tour of the lab. Chemical smells tickled Vivien's nose. His fingers itched to touch the equipment with fascinating names such as spirometer, and blood gas manometer. Dr. Blaylock said he needed someone he could teach to do anything I can do, and maybe do things I can't do. Vivien listened carefully as Dr. Blaylock talked about his research projects. One of the projects captured Vivien's attention. Dr. Blaylock explained that if a person was seriously injured and lost a lot of blood, his or her body sometimes went into shock. This meant the person's blood pressure became dangerously low because too little blood flowed to the body's organs, such as the heart and lungs. This often led the patient to dying. Dr. Blaylock was researching treatments for these shock patients. As Vivien listened, he also asked questions about the different procedures the doctor had tried. Dr. Blaylock was impressed with Vivien and offered him the job right away. On Vivien's first day of work, Dr. Blaylock asked him to put an animal to sleep to prepare for a shock experiment. Vivien was uncomfortable with the idea of using animals for research, but Dr. Blaylock explained that their research could save thousands of lives. So Vivien weighed the animal and calculated how much medicine it needed to fall into a deep, painless sleep. Then he set up the blood pressure equipment. Under Dr. Blaylock's supervision, Vivien learned to conduct experiments and write lab reports detailing each step. Dr. Beard, another doctor in the lab, loaned Vivien medical textbooks. He told Vivien it was nice to be able to do a thing, but it was still better to know why you were doing it. It wasn't long before Vivien was completing experiments from start to finish on his own. Vivien's surgical techniques improved with each operation. Just as he had learned to fit the pieces of wood together seamlessly, Vivien learned to suture or sew blood vessels together seamlessly. Dr. Blaylock was very impressed by Vivien's tiny stitches. Sometimes Vivien assisted Dr. Blaylock with an experiment. On other days, Dr. Blaylock assisted Vivien. Vivien was happy working as a researcher until he learned that his official job description was janitor. White men with the same duties and skills as Vivien were called research technicians and earned more money. Vivien was insulted. He was not a janitor. He told Dr. Blaylock that he would not continue working unless he was paid the same as other technicians. A few days later, Vivien noticed his paycheck was much better. He now earned about the same as white technicians. In 1941, Johns Hopkins Hospital in Baltimore, Maryland, invited Dr. Blaylock to become chief of surgery. He accepted with one condition. His research technician, Vivien Thomas, must be invited too. Vivien didn't want to leave Nashville, but he knew he would be fired from Vanderbilt as soon as Dr. Blaylock left. Many of the other doctors were not happy that Vivien had been working independently as a researcher. Vivien accepted Dr. Blaylock's offer. He was excited to start his new job at Johns Hopkins as surgical technician in research. But Vivien had a hard time finding a nice home for his family in Baltimore. The better houses and apartments were for whites only. It took months for Vivien to find an apartment. Johns Hopkins was much more segregated than Vanderbilt. There were whites only and colored cafeterias and restrooms in the hospital. Vivien was the only African American working as a researcher. The stares and whispers in the hallways were worse than at Vanderbilt. But Vivien refused to let the prejudice of others interfere with his work. In 1943, Dr. Helen Taussig, a pediatric cardiologist, visited Dr. Blaylock's lab. Dr. Taussig treated children with heart problems. Many of her patients were born with a heart defect that made their skin look bluish. Their bodies did not get enough oxygen, and over time the children died. Dr. Taussig called these small patients her blue babies. Most doctors refused to do open heart surgery on a child. They believed children couldn't survive such an operation. Even so, Dr. Taussig asked Dr. Blaylock to find a way to operate on her heart patients. Dr. Blaylock was too busy with his own patients, so he assigned Vivien to do the research. Vivien headed for the Pathology Museum to investigate the collection of blue babies' hearts. He knew that a healthy heart pumps blue blood into the lungs to get oxygen. Once the blood is full of oxygen, it turns red. The red blood flows back to the heart and is delivered to every part of the body. With blue babies, however, something else was happening. Vivien noted the 4 defects in the heart that blocked some of the blue blood from reaching the lungs. This meant the blood continued to circulate throughout the body without its oxygen fill-up. How do you get more blue blood to the lungs? It was a mystery Vivien was determined to solve. After a few months of experimenting, Vivien realized that the solution might be a procedure he and Dr. Blaylock had perfected at Vanderbilt for a different problem. The procedure involved creating a shunt between 2 arteries. If they sutured an artery coming from the heart directly to an artery going to the lungs, it would create a direct connection for the blood to make it to the lungs. Then a child's body would have all the oxygen it needed. Vivien tackled the next problem. Most needles were too long for a child's tiny chest and blood vessels. He needed to make needles small enough to use on a baby. Vivien snapped off a half-inch long piece of needle. Holding the eye end with a clothespin, he filed the other end of the needle to a razor-sharp point. Now he had a needle short enough to stitch together tiny arteries inside a child's chest. Vivien tried out his procedure and the new needles on research animals. He found a way to attach 2 arteries successfully and have extra blood circulate to the lungs before it flowed back to the heart and then throughout the body. Dr. Blaylock assisted Vivien only once during his experiments. On November 29, 1944, Dr. Taussig called Dr. Blaylock about Eileen. one of her blue baby patients. The child was so sick that she would die if they did not operate on her immediately. Vivien knew his operation worked on animals, but would it work on a little girl? The next day he would find out. Dr. Blaylock was going to perform the procedure designed by Vivien. The morning of the operation, Vivien went to the operating room to check the instruments. Vivien headed back to the lab, but Dr. Blaylock insisted he return to the operating room. Dr. Blaylock asked Vivien to stand on a stool behind him and guide him through the operation. Some of the other doctors grumbled. What could Vivien possibly know? But Vivien focused on Dr. Blaylock's hands and the baby on the table. Dr. Blaylock opened Eileen's chest. Vivien's own heart thudded with worry. The baby's blood vessels were so small. Were his needles tiny enough? Dr. Blaylock began the operation. Is my incision long enough? He asked Vivien. Yes, Vivien responded. Dr. Blaylock began to suture in the wrong direction. Other way, Vivien cautioned him. 90 minutes passed. Finally, the operation was over. Would Eileen survive? The baby's lips are a glorious pink color, Dr. Talsik said. Eileen did survive, and slowly, over the next few hours, her skin went from blue to a healthy pink color. After 2 more successful operations, Dr. Blaylock and Dr. Talsik wrote a scientific paper describing their innovative surgical procedure, which they named the Blaylock-Talsik Shunt. National magazines such as Time and Life praised Dr. Blaylock and Dr. Talsik. Vivien Thomas's name did not appear anywhere in the paper or magazine articles. As the news spread of Dr. Blaylock's success, 2 of the 3 operations a week soon became 2 or 3 operations a day. Patients came from far away as Europe to have the procedure. Vivien remained standing on the stool behind Dr. Blaylock, coaching him through more than 150 operations. In 1947, Dr. Blaylock and Dr. Talsik were nominated for the Nobel Prize in Physiology or Medicine. Although they did not win, doctors from all over the world traveled to Johns Hopkins to observe and learn the new heart procedure. When Dr. Blaylock was busy, the visiting doctors went to Vivien with their questions. Vivien graciously shared his knowledge and skills. Vivien Thomas was not publicly acknowledged for his brilliant research and surgical talents until more than 26 years after the first blue baby operation. On February 27, 1971, the Old Hands Club, a group of doctors who had trained under Vivien, presented a formal portrait of him to Johns Hopkins Hospital. It is displayed across from Dr. Blaylock's portrait. In 1976, Johns Hopkins University awarded Vivien an honorary doctorate degree and appointed him to the faculty as instructor of surgery. Although he never had a chance to attend medical school, Vivien's research pioneered open heart surgery on children. Today, about 40,000 children are born each year with heart problems. Because of Vivien Thomas, these children now have a chance to live full and healthy lives.